Hello, my name is Courtney Reeves. I'm currently enrolled at Chipola College in NUR 3165 with Mr. Tommy Simmons. For my final paper, A Problem in the Nursing Field, I chose to write about communication, and I have here a copy of my final paper that I'll be referencing. I wrote that Webster's Dictionary defines communication as the act or process of using words, sounds, signs, or behaviors to express or exchange information, a message that is given to someone, a letter, telephone call, etc. A problem that could arise from lack of communication is the communication between a doctor and a patient. Patients often feel rushed and they don't feel like that they're given that one-on-one time between the doctor because they run in and out on their lunch breaks, whether it be after hours and they're anxious to get home. So patients don't always fully understand their diagnosis or the procedure that may be as a result of their diagnosis. Another error that can rise out of poor communication is medication errors. A quote that I wrote was, "Incomplete orders may lead to more medication errors because of assumptions, sometimes wrong, which have to be made by the nursing personnel or pharmacy." For example, if a physician does not clarify the quantity of the medication ordered, this could be interpreted as 1 or 2 or any other quantity, which inherently could lead to error. If doctors aren't thorough in their notes about what medications to give and how often, then that can lead to error. Patients may be overdosed or not medicated enough. Antibiotics may be missed that may be pertinent to their diagnosis, and their home medications may not be started if the doctors aren't aware that their home meds are listed on the chart. The biggest doorway to error is the handoff reporting. Nurses are often ready to get home at the end of their shift, so they just run through the basics on the patient when pertinent information may be left out. It could be something so simple as which site the IV is in order to get fluids and antibiotics. Shift change is often a busy time. The nurse's station is busy, the call bells are going off, people want pain medication, etc. Barry states in a survey of medical and surgical residents, 59% stated that at least one of their patients had experienced a medical error as a result of inadequate patient handoff communication. This is a big percentage of patients that are getting a medical error due to lack of communication. To help all these problems involving communication, all staff must be on board. The doctors, nurses, and even the patients must be involved in the patient's care. Another quote was, "Patients bring individual learning needs and style preferences, unique language skills, cultural differences, age-related and physical, cognitive changes, disabilities, and emotions that can affect listening and learning." It's important that doctors and nurses take this into effect when talking with these patients on a one-on-one level. Also, to prevent medical errors, it's important that 2 nurses verify medications prescribed by the doctor. And it's also important that when receiving verbal prescriptions that the nurses read back the information to make sure that the order is correct. To maintain patient compliance with their diagnosis, detailed discharge instructions should be given. If you have a newfound diabetic, it's important that you discuss their diagnosis, how often to check their sugar, when to give insulin, when not to, and what foods to avoid. Also, to prevent the condition from worsening for patients, handoff reporting should also be done with bedside reporting. If 2 nurses go in together and look at a patient, then they can compare changes that they've seen throughout the shift. They can discuss where the IV is, they can discuss their diagnosis, and it establishes a therapeutic relationship between the 2 nurses and the patient's family. That allows plenty of time for the patient to ask questions and to feel safe and secure in their surroundings. The nursing field is full of problems. Communication is not the only one, but personally I've dealt with communication errors and I felt like that it was pertinent to this assignment. So to prevent further harm to the patient, nurses should be advocating for their patient, bedside reporting, verifying orders, etc. Thank you so much for your time. Again, my name is Courtney Reeves.